sa acupuncture. Ating pong topic ay types of qi. So, pagpapatuloy po ito, ano? Types of qi, number 3. So, yung qi. Actually, na pag-aralan na natin sa mga nakaraan. So, babalikan po natin ngayon. Qi. Qi flow obstructed. So, pag obstructed, body cannot perform 5 cardinal functions. So, magkakaroon ng sakit pag hindi nagampanan ng qi yung kanyang 5 cardinal function. Maalala po natin kung ano yung cardinal function. Ano? Mamaya madidiscuss natin ano ba yung mga cardinal functions sa dulo po ng ating webinar. Okay. Yung qi deficiency, ito po yung mararamdaman. Fatigue, lowered immunity, poor digestion, breathing problems. So pag mayroon po tayong kakulangan sa qi, yan po yung mga mararamdaman natin. Pag qi excess naman, nagkakaroon ng stress, insomnia, at nagkakaroon ng dry mouth. So, okay po. So, yan po yung food qi or good qi. Ang tawag po sa sa Chinese, good qi. Pero ito po yung food qi na nanggagaling sa ating mga kinakain. First stage in transformation of food into qi. Siyempre, saan nanggagaling yung pagkain? Pag kumain tayo, bababa po sa ating stomach and extract po ng spleen. Spleen extract food into qi and send up to the lungs. So, pag na-digest na po yan, yung qi po pupunta na sa ating lungs. Tapos where it may transform into various other kinds of qi. Example, yung Zong Qi or blood. Makikita po ulit natin, review natin yung flow kung paano siya magiging blood, paano magiging nutrition ng ating katawan, yung mga kinakain natin. Okay po, next. So yung gathering qi naman po or ancestral or so nourishes heart and lungs. Ito po yung function niya, no? Promotes lung function of controlling qi and respiration. And heart function of governing blood and blood vessels. Number 3 po, kinokontrol niya yung speech and strength of voice. Promotes blood circulation to extremities. So, yun po yung role ng Zong Qi. Yung True Qi naman po, or yung Zen Qi, mamaya ma-review natin ano ba yung Zen Qi na yon. So, yung final stage po of Qi transformation, ito Zen Qi. Okay. So, nagsisirculate po ito sa channels at siya yung nagno-nourish sa mga organs. So, pag na-digest na ng spleen, stomach, dadalhin kay lungs. So, magko-combine po yung mga qi. Ito po yung final qi. So, originates from the lungs po ang Zen Qi. Assume to different forms. Ito po yung nutritive qi, jing qi, and defensive qi. Yung nutritive qi po, ito yung dinidistribute sa ating mga organs upang tayo ay maging, mayroon tayong lakas at maging malusog. Tapos yung isang qi naman po, yung defensive qi, dinidistribute po ito ni lungs through wei qi. Siya yung protector qi natin sa ating mga balat para hindi tayo madaling lamigin, hindi tayo madaling sipunin, lamigin, papasok yung init. Yun po yung ating wei qi o defensive qi. Yung nutritive qi naman po or construction qi or yung jing qi. Ang role po nito ay nagno-nourish ng internal organs and the whole body. So closely related to blood and flows in the blood vessel and channels. Is activated whenever a needle is inserted in an acupuncture point. So ito po yung na-activate pag nag-acupuncture tayo, itong nutritive qi. Siya po yung pinapadaloy natin din sa ating mga blood vessels and channels. Okay po. Yung defensive qi naman or yung wei qi, ito po ay coarser than yin qi. So nagpo-flow pa siya sa outer layer of the body. So papunta siya sa skin, outer layer. So ang role niya protects the body from attack of exterior pathogenic factors. Pag malakas po ang ating wei qi, hindi tayo agad nagkakaroon ng sakit. Halimbawa, malakas yung hangin, hindi ka kaagad sisipunin kasi yung protective chi na Wei Chi ay malakas, defensive chi siya. Parang yung sundalo natin sa ating katawan. Ayun po yung ating diagram o drawing. So from the blood, mayroon tayong Jing Chi. Tapos yung Chi na yon, papunta palabas, yun yung Wei Chi. So yung Wei Chi ay i-defense tayo exterior pathogenic factor. Yun nga, kung may mga papasok na lamig, init, sobrang hangin, yun, ipoprotect po yung katawan natin. Kaya kung mahina po ang defensive chi natin, madali tayo magkasakit kasi papasok agad sa internal organ natin. So pag interior naman po, ang nagde-defense sa atin ay yung chi. Tsaka itong nutritive chi, ito yung mga galing sa pagkain at na nagiging blood. Okay po. So, ano pa yung role ng defensive chi natin? So, yung defensive chi natin or ang Wei Chi, warms, moisten, and partially nourishes skin and muscles. So, kung hindi po healthy ang ating skin, yung defensive chi po natin mahina. Hindi niya kayang i-moisten, yung laging nagda-dry yung skin nyo, yung Wei Chi po natin mahina. Madali kayong magkaroon ng skin problem, magkaroon ng mga sakit sa balat. Yan, mahina po yung Wei Chi. Adjust the opening and closing of the pores and therefore regulate sweating. So, kung mahina po ang defensive chi natin, yun, pawis ka ng pawis ng kahit malamig na mamawis ka. Kasi hindi na po close yung pores dahil mahina yung defensive chi mo. Pag malakas ang defensive chi, i-close niya yung pores para hindi lumabas yung mga fluid ng katawan. Siya din po yung nagre-regulate the body temperature chiefly by regulating sweating. Halimbawa po, nagpainit kayo. So kung malakas ang defensive chi nyo, palalamigin yung inyong katawan sa pamamagitan ng pagpapawis. Palalabasin niya yung pawis para i-cool down yung body. So under po yan ang control of the lungs. Yung chi na ito na Wei Chi. Kaya napakahalaga po nitong Wei Chi. Kung mahina ang lungs nyo, mahina rin si Wei Chi. Yun ang mararamdaman nyo. Yung mga function niya hindi niya magagawa. Nagkaroon po ako ng pasyente noon na kaya lang late na po nung dinala sa akin na pag umupo po siya, foreigner po to, pumunta pa ng Pilipinas para magpagamot pero late na eh. Kasi pag umupo po siya, para po siyang umihi sa pawis, from yung ulo niya, tagaktak po ng pawis, pababa, pababa. Nung inacupuncture ko po, medyo na-lessen. Kaya lang, nung umalis ng Aurora, hindi ko na natuloy ma-acupuncture. Nabalitaan ko namatay din. Kasi sana tuloy-tuloy na palalakasin yung lungs niya para yung Wei Chi niya, lumakas din, ma-close yung force ng kanyang skin. Kasi talaga pong para siyang umihi nang dumadalo yung tubig. Talagang nauubos po yung fluid ng tubig niya. Kaya kailangan niyang uminom ng uminom. Yun po yung nangyari. Okay po. Yung central chi naman po or yung Zong Qi, yung Zong Qi po ito, combination na po yan ng yung from food na kinain natin na nagiging chi, tapos yung chi na galing sa hangin, pag nag-combine po yan dun sa chi na minana natin or yung yuan chi, yung po yung nagiging Zong Qi. Yan. So refers to the chi of the stomach and the spleen. So also used in cases of deficiency of spleen chi which result in prolapse of an organ. So kung mahina po ang ating central chi or Zong Qi, yung nagkakaroon po ng mga luslos at saka yung ano ba tawag doon, yung basta nagkakaroon po ng mga problema, hindi ma-hold ng katawan sa proper place yung mga organ. Kaya sa lalaki nagkakaroon ng luslos. Yun po yun. So upright or correct chi, ito yung Zeng Qi. Usually only used in relation and contrast to pathogenic factors. Example, Zei Qi, and indicates the body resistance to exterior disease. So syempre kung malakas po yung itong Zong Qi natin, Wei Qi natin, yung body natin ay makakalaban siya sa mga exterior pathogenic factor. Ano ba yung exterior pathogenic factor na yan? Yun nga po, pag sa TCM kasi ang pinanggagalingan ng sakit ay mula sa sobrang lamig, sobrang init, sobrang hangin. Yan. Pag pumasok po yan sa katawan natin, di ba nakakaramdam tayo ng nilalagnat, nilalamig. Yon, hindi na po nababalanse yung yin and yang or lamig at init ng katawan natin. Kaya yun pa yung mga role ng Qi. Okay po. Ito po yung diagram, balikan natin. Naituro na po ito noon, balikan natin para sa mga bago. Diagram of production of Qi. So pag kumain po tayo, food and drinks, papasok po siya sa stomach and spleen. Then, pag nandun na po, i-grind po niya, magko-combine po yung hininga natin, yung hinihinga natin na fresh air, yung dachi, siyempre lungs naman ang gagawa po nun. So, pag nag-combine na po siya ng food and drink chi, ang tawag po dun shugo, shiji. Sa Chinese po yan, Pag nag-combine na yung from the air na nasa galing sa lungs at from the stomach spleen na food and drinks, ang mabubuo po niyan ay gathering chi or yung Zong Qi. Ito naman si Zong Qi, meron po tayong nakaimbak sa ating kidney, mga minana natin na chi sa ating magulang nung pinanganak tayo, nilagay po yan sa kidney. Iko-combine po yan sa Zong Qi, yung Yuan Qi, magkakaroon po ng Zen Qi o tinatawag na True Qi. So yung Zen Qi na yan, magiging Jing Qi o Construction Qi. Ito na yung nagiging dugo. Then isi-circulate po sa different organs natin para dadalhin sa puso, sa atay, sa spleen, stomach, lahat ng organs natin dadalan po niyan. Tapos yung Wei Qi naman po, galing po to sa baga, i-distribute niya sa external ng body para depends yung body natin. Kung lahat ng Qi natin ay malakas, healthy po tayo. Pag may nag-unbalance po dyan, yun, nagkakaroon tayo ng sakit. So yung role ng acupuncture dyan, pag yung mga Qi natin ay hindi na balanse, pag in-acupuncture po, babalansehin niya. Tatanggalin niya yung mga init at lamig, sobrang hangin na pumasok sa atin, katawan, na mula sa pwedeng pinanggagalingan nito external climate at pwede rin galing sa emosyon, sa lifestyle. Yun po yung mga pinanggagalingan Tapos yung iba pang mga dahilan, halimbawa yung may mga ascaries, yung mga pinanggagalingan po, tapos yung ating mga trabaho, dun po yung mga pinanggagalingan ng sakit natin. Kaya naaapektuhan po itong mga Qi na to. Pag naapektuhan siya, magkakaroon tayong sakit. So pag pumunta kayo po magpa-acupuncture, babalansin po ng acupuncture yung mga hindi na balancing Qi sa katawan. Okay po. So ito po yung pangunahing function ng Qi. Dahil ang Qi ay kinakategorize natin na Yang. Kaya siya po yung nagta-transform. Halimbawa, yung Qi ay nasa spleen stomach natin, ang function ng Qi doon, i-transform niya yung mga food para maging nutrients at maging dugo na di-distribute sa different organs natin. Siyempre, pag na-transform niya, ita-transport. Kaya dapat ayos yung Qi. Kaya para kaya niyang i-transport. Pag hindi ayos yung Qi, magkakaroon po ng stagnation or magkakaroon na ng dump. Siya na yun, nakakaramdam tayo ng mga bukol-bukol, mga makikirot, kasi may mga hindi na na-transport na mga nutrients sa katawan natin, hindi nakakarating dun sa mga organs. At syempre, ito yung function pa rin ng Qi, yung holding. Halimbawa yung mga fluid natin na dapat nasa katawan, hold din niya na hindi lalabas. Ganun din po yung ng racing. Siyempre, yung mga Qi na yan, isa para halimbawa yung mga bata, kailangan nilang lumaki. Kaya may Qi tayo na yun, yung racing na nagiging para lumakas at lumaki ang mga muscle natin, ang buong katawan natin. Tapos protecting, yung diniscuss natin kanina na nasa lungs, di ba? Pag dinistribute ng lungs yung Wei Qi, i-protect tayo dun sa mga sobrang hangin, sobrang init, sobrang lamig. At yung warming din, kasi yung katawan natin, kailangan may balancing init at lamig. So, kung maayos yung Qi, kung ikaw ay sobrang may mga pathogenic factor na papasok, iwa-warm niya. Yan. Halimbawa, yung mainit ay malamig. So, yung body iwa-warm. Kasi dapat yung body natin nasa balance yung init at lamig. So, yun po yung mga function ng Qi. Enerhiya sa Tagalog. Okay po, salamat po. Bako po may tanong.
Maraming salamat, Ma'am Mildred. Napakaliwanag ng explanation. So, it's always good na ulit-ulitin natin po yung ating mga basics, no? So,
Opo, kasi pag nagda-diagnose na po tayo, napakahalaga yun para alam natin anong nangyari sa mga Qi.
and we should always emphasize na dapat gawing regular yung acupuncture sessions. No? Maraming salamat po. We will proceed to tongue diagnosis. Okay, so we will continue where we left off last time before we had the break. Nasa general principles pa rin tayo. So we are now on part 2. No? Now let's proceed to techniques of observation of the tongue. One should not ask the patient to hold the tongue out for longer than 15 seconds because the longer you extend the tongue, the darker it will tend to become. So this will affect the diagnosis. No? So if we need longer than 15 seconds to observe the tongue, which we normally do, we should ask the patient to withdraw the tongue, close the mouth, then extend the tongue again. Pwede ito gawin several times without affecting its body color. Basta ang importante is do not hold out or stick out the tongue too long. It is very important to examine the tongue systematically, following always the same order. So first, you have to look at the tongue body color, then titingnan mo yung shape, then the coating, then the spirit, no? The shed. So again, the color, the shape, then the coating, and the spirit. It is strongly recommended to follow the systemic order of observation of the tongue because it reflects the relative clinical importance of each factor. For example, yung tongue body color reflects conditions ng heat or cold and deficiency of yin or yang in various organs, especially yung yin organs. So dapat ito po yung first aspect that we observe. The tongue body shape will just add the information to that gleaned from observation of the tongue body color. So parang follow through lang po siya, no? So to check the body color, the color is the tongue body color, it will determine hot or cold, yin or yang, deficiency. And then, i-correlate mo yan ngayon with the tongue body shape. For example, if the tongue is pale from yang deficiency, if the tongue is swollen, it will indicate na yung yang deficiency niya is particularly pronounced. And then the tongue coating, this will reflect more the condition ng yang organs. Okay? And the coating is easily influenced by short-term factors. So this is relatively less important than observation of the tongue body color in chronic conditions. Next, we go to external factors affecting the color of the tongue. So the most obvious external factors are highly colored foods. So you have to always check ano ba yung kinain niya, no? Sweets, drinks, or pastilles. If a patient's tongue is a very obvious, unusual bright color, always ask what he has been eating. Spicy foods katulad ng cayenne pepper and curry may tend to make the tongue slightly redder soon after consumption. Okay. So tobacco smoking usually colors the coating yellow. In regular smokers, the yellow is permanent. Okay. Just like the patient that I have last Saturday. However, this cannot be written off as no more than a false appearance due to an external factor. Tobacco, which has a hot energy, will tend to create heat. So please remember that. Medicines. Some medicines affect the appearance of the tongue, most commonly antibiotics. Drugs will tend to make the tongue partially peeled. So ibig sabihin, there will be loss of small patches of coating. So when you see such a tongue, the first thing that you should ask is whether the patient is on antibiotics or has taken them recently. Okay? So this is the picture of the tongue of someone who is on antibiotics. So if you notice, it will peel the tongue partially. So the effect of the antibiotics on the tongue will last about 2 weeks after the course has been stopped. So judging from the effects of antibiotics on the tongue, we have seen that this can injure the stomach yin, nawawala yung coating. Oral corticosteroids will tend to make the tongue red and swollen. Whereas kung naka-bronchodilator, inhaled bronchodilators, for example, salbutamol, may cause the tip of the tongue to become red, but only after many years of use. Now, if the patient is on anti-inflammatory drugs like phenylbutazone, paradoxically, it will cause the tongue to develop red points. Dapat nga anti-inflammatory, but it can cause red points. No, most cytotoxic drugs used for cancer tend to create a very thick dark yellow or brown coating and also make the tongue body red. So that's it for the general principles. Any questions?
Yes,
Okay.
Doc, pag nilalabas din, Doc, ng matagal kasi yung tongue, nagkuquiver din po siya eh.
Oh,
Kaya
yeah.
dapat hindi po matagal na ilalabas pa, 15 seconds lang.
Yeah. What I usually follow is pag medyo matagal-tagal na, ma-estimate mo lang naman yan. Nagbabago kasi yung itsura, no? So,
Opo.
balik mo, pasara mo yung bibig, labas ulit. Okay. So, thank you very much. Let's now go back to Ma'am Mildred for diagnosis by interrogation. Feeling of cold. Ma'am Mildred, please do the...
Opo. Yes, Doc. Wala po akong makita sa screen, Doc. Ayan. Feeling of cold. Exterior conditions. External invasions. In external invasions, a feeling of cold or shivers serves to establish whether the pathogenic factor is on the exterior or in the interior. So in fact, when the pathogenic factor is on the exterior, the patient feels cold, shivers, and dislike the idea of going out, then referred to as aversion to cold. So pag nasa exterior pa lang po ayaw niya ng, pag cold yung papasok, ayaw din niya ng cold. The feeling may or may not be accompanied by actual fever, but it will be associated with heat in the skin. That is, the patient feels cold and shiver, but his or her skin feels hot to touch. So parang umiinit kasi nagpo-protect pa lang yung yung skin mo yung body, yung Wei Qi. Nagre-release siya para hindi makapasok yung lamig kaya papainitin niya yung balat. So ano po yung ginagawa ng ating Wei Qi. Okay po. The areas usually touched to gauge this are the dorsum of the hand of the forehead. So itatouch po natin yung ating yung ulo. Yan. It should be stressed that the feelings of cold and fever or body feeling hot to touch are simultaneously and not alternating. Thus, if a patient feels cold in the morning without a fever and without body feeling hot to touch and has the fever in the evening, this would correspond to Lesser-Yang syndrome, and would not constitute the beginning stage of an invasion of wind. Differentiate the manifestation of cold feeling in the exterior and interior condition. So, yun po yung feeling of cold, so pag nasa exterior pa lang, ang nararamdaman po ay nilalamig ka, medyo nanginginig, shivering. Tapos pag hinawakan mo po yung dorsum of hand, possible fever. May konting nilalamig at saka parang mainit. Yan. So lumalaban kasi yung Wei Qi mo. 'Di ba yung sa diagram natin nakita natin noon na parehong tumataas kasi. Tataas siya, habulin niya para mag-level up. Pag wind cold po ang papasok, ang nararamdaman niya ay cold feeling. Pag wind heat naman, cold feeling less pronounced. Yun. So pag nasa interior na po, ang mararamdaman na po feeling cold. Yung cold feeling po yun feeling cold. Interiorize na siya, nag-interiorize. Lalamig na rin po yung paa, pati yung mga limbs, tsaka yung dorsum of hands, not hot. Hindi na po siya mainit kasi naka-interiorize na. Hindi na, natalo na yung Wei Qi. So cold feeling in the exterior and interior condition. So, pag lamig pa ang pumasok, pag nakapasok na, malamig na siya. Malamig ng pakiramdam. Okay po. An exterior syndrome, the presence of a cold feeling and shivering, is determined factor in diagnosing that the pathogenic factor is still on the exterior. So, kasi lumalaban pa nagkakaroon ng ng cold feelings at saka nagsishiver siya, and that the pattern is therefore an exterior one. As soon as the cold feeling disappears and the patient feels hot, this is a certain sign that the pathogenic factor is in the interior. So, pag parang nilalagnat na siya, nakapasok na. So, it has transformed into the heat. One can see this sign very clearly in small children. When the pathogenic factor is on exterior, the child will tend to go to bed and cover himself or herself. Diba yung para sa, mama nilalamig ako, yun, nagsisimula na po kasi papasok eh. So, magkukumot siya. As the pathogenic factor enters the interior, usually changing into heat, the child throw the blanket off. Yun, pag nakapasok na, lalagnatin na siya. So, iinitin na yung bata. Tatanggalin na yung kanyang blankets. So, yun po yung sign nung nakapasok na yung mga pathogenic factor. So, interior versus exterior, pathogenic factor. Pathogenic factor in the exterior, so ang nararamdaman po ay feeling of cold, shivers, dislike of going out, so possible a fever, patient is hot to touch, especially forehead and dorsum of the hand. So pag ang pathogenic factor ay nasa interior na, ang pakiramdam na po niya ay mayroon ng cold feeling disappears, patient feels only hot. So yun na, may fever na po siya, parang nilalagnat na siya. So pag wind cold naman po versus wind heat. In the exterior patterns, both wind cold and wind heat cause a cold feeling and shivering. So pareho po yung nakakaramdam ng nilalamig tapos nanginginig. It is a common misconception that it is not the case with wind heat. Since the cold feeling is caused by the obstruction of defensive qi by wind, whether it is wind cold or wind heat. So yung defensive qi natin, haharangan niya. In the space between the skin and muscle, the cold feeling and shivering is also present invasion of wind heat, albeit to a lesser degree than a wind cold. So, pagpapasok pa lang sila, parang nilalamig na nanginginig tapos yun, yung muna po yung nararamdaman. Pag nakapasok na, makakaramdam na sila ng lagnat na lang. Okay po.
Okay,
Thank you.
Thank you very much, Ma'am Mildred. We will now continue with the pulse diagnosis. Okay, pulse na naman tayo. So we will continue with the discussion of the classification of pulse qualities. Okay. We will now summarize the pulse qualities and their clinical significance by grouping them according to the main patterns. Okay. Pag Qi deficiency, yung pulses, empty, pwedeng short pulse, pwedeng scattered. Pag Yang deficiency, deep, weak, hidden. Pag blood deficiency, choppy, fine, or scattered. In deficiency, fine, minute, leather. Itong leather, I find this very common amongst yung mga medyo maedad na, no? Usually 70s up. I've encountered this. And now, okay na siya. Okay. So, hindi na siya leathery. Qi stagnation, you will have a wiry pulse. Pag blood stasis, you'll have 3 types of pulses. Could be wiry, choppy, or firm. Pag phlegm, slippery to wiry. Dampness, soggy to slippery. Now let's go to classification of pulse qualities according to the 8 principles. Okay. Pag Yang deficiency, weak, there are 3 pulses under Yang deficiency: weak, slow, and deep. In deficiency, fine, minute, floating empty, and leather. Pag collapse of Yang, hidden, slow, and scattered. Collapse of Yin, minute, and rapid. So exterior, interior. Pag exterior, you'll have a floating pulse. Pag cold naman, under exterior, floating and tight. Okay, pag heat, floating and rapid. Pag deficient, floating, slow, and weak. Excess, floating, full, and tight. Pag interior, the pulse is deep. No? So pag cold, interior cold, deep and slow. Pag interior heat, deep and rapid. Interior deficient, deep, weak, excess, deep, full. Okay, heat or cold? Pag heat, so there are 5 pulses here, pwedeng rapid, hasty, hurried, big, overflowing. Pag cold, slow, knotted, or tight. Deficiency and excess. Pag deficiency, ang daming klaseng pulses. We have empty, weak, choppy, fine, minute, soggy, short, hollow, leather, hidden, and scattered. Pag deficiency of Qi, empty, soggy. Deficiency of Yang, weak, hidden. Deficiency of blood, choppy, fine. Deficiency of Yin, fine, minute, leather, floating, empty. Okay, pag excess, full, slippery, wiry, tight, overflowing, big, firm, long. Pag Qi stagnation, wiry. Blood stasis, pwedeng wiry, choppy, firm, and slippery. So thank you very much. Are there any questions? Okay, still
Kailangan po matandaan yun, Dok, ano? Kailangan matandaan pa ulit-ulit natin yun.
paulit-ulit. Yeah. Now let's proceed to differential diagnosis, and let's listen again to the ever reliable Ma'am Mildred.
Nandito na si Sir Alvin. So, extreme heat generating wind. DCM Foundation, 178. Yung extreme heat generating wind, etiology, invasion of exterior heat or wind heat penetrating to the blood levels, generating internal wind. Underlying accompanying pathology, this pattern is only encountered with acute febrile disease. So, possible presenting condition, yung mga measles, encephalitis, and meningitis. Sign and symptom, meron po silang mga high fever with thirst. Nauuhaw kasi matataas yung lagnat talagang mainit. Tapos yung kanilang mga mukha po ay red face, at saka pati mata. Nagkakaroon din sila ng convulsion kasi sobrang init nga. Rigidity of the neck and back, upward staring eyes, yung tumataas po yung yung mata yung sa Tagalog. Clenched jaw, tremor of the limbs, coma in severe cases. So pag sobrang init na po, nagko-coma. So may mga organs na talagang affected. Siyempre heart po yun. Pag nagko-coma, nawawala ng malay. Pulse, pag hinawakan po natin, wire at saka rapid. Mabilis kasi init nga Tiningnan tang, deep red, steep, dry, yellow coating. So, puro po sign ng heat. Red, dry, and yellow. So, yung treatment principle po natin dito, calm the liver and extinguish wind. Kasi, yung liver po yun yung prone sa wind Clear heat, kailangan natin tanggalin yung heat na pumasok sa organs. So, yung acupuncture treatment po natin gagamitin ay ang gallbladder 20 upang extinguish exterior wind. Large intestine 11, subduce hyperactive liver Qi. Tapos heart 8 po, quiets heart, regulates spirit. Liver 2, clear the liver's heat. Kasi extra point pong gagamitin natin ay ang pwede tayong gumamit ng nagki-clear ng heat, extinguishes wind, yung Do-20, interior wind. Inidal po natin to with drainage and prick 12 well points to bleed. So pag sobra pong init, kailangan yung mga cheng point, pwede po nating paduguin. Para, kasi di ba yung pag-aaral natin, yung heat, karaniwan, nandun sa blood. So, pag tinanggal mo yung mga init, yung blood po yung ipiprick mo para lumabas yung init. Yung liver tree po para i-disperse ni liver at magkaroon ng subdued wind. Kasi nga nandun kay liver yung wind eh. So, tonify mo siya para alisin niya si wind. At ang pericardium 8 extinguishes wind. Nagtatanggal din po siya ng hangin sa katawan. At pinalalamig nito ang blood, cools the blood. At ang Do-8 extinguishes wind, relieves spasm. At ang Do-14 extinguishes wind, clear heat. So, puro po pagtatanggal ng wind, ano. Tapos, stomach 3 extinguishes wind from the governing vessel. Do-16 extinguishes interior wind. So, pipili lang po tayo doon ng mga points na gagamitin natin per session. Extreme heat po yun na nag-generate ng wind. Arigato po. Thank you very much.
Thank you
Arigato.
very much, Ma'am Mildred. Okay, tuloy-tuloy tayo with the next one topic. We will continue sa wheezing. If you remember, before we had the break, Sir Dino was lecturing on the wheezing. No? Okay, key points of analysis. Wheezing is the result of combined exogenous evil strength and genuine qi deficiency. During an attack, the exogenous evil, or ito yung tinatawag na external pathogenic factor, is the principal factor. During remission, genuine qi deficiency is the principal factor. New onset wheezing is mainly due to a strong exogenous evil. Chronic recurrent wheezing, this is because of qi deficiency of the lung, spleen, and kidney. Exogenous wheezing may be precipitated by cold or heat. If the exogenous wheezing is precipitated by cold, it is known as cold wheezing. In general, cold is in both the interior and the exterior. Main symptoms: respiration that sounds like frog croak, cough with thin, clear, or white foamy sputum, no thirst, pale tongue with white and smooth coating, floating and tight pulse. If precipitated by heat, it is known as heat wheezing. Generally, phlegm and fire are both strong. Main symptoms: hoarse breath sounds that resemble sowing barrel chest, cough, yellow and viscid sputum that is difficult to expectorate. There is thirst with desire to drink, red tongue, yellow and greasy tongue coating, slippery and rapid pulse. Now let's talk about deficiency wheezing. This is due to qi deficiency of SLK, spleen, lungs, or kidney. In deficiency of lung qi, wheezing is associated with spontaneous sweating, wind intolerance, shortness of breath, and weakness. In spleen qi deficiency, it is associated with anorexia, diarrhea, and copious sputum. In kidney qi deficiency, meron pong lumbar aches, tinnitus, wheezing, and fatigue on engaging in any activity. Now, let's go to acupuncture treatment. Illnesses of strength. Acupuncture po is suitable. Ito yung excess. Now, the most commonly selected acupoints are Do-14 or GB14, Do-12, Bladder 12, Bladder 13, Stomach 40, CV17, LI11, LI4, Sanjiao 15, LI1, and Lung 10. For cold wheezing, we select CV17, Bladder 13, Bladder 12, and lung 7. Okay, excess siya, so we use reducing method and apply moxibustion. For heat wheezing, we use moxibustion kasi po may cold, no? So for heat wheezing, we select lung 1, bladder 13, lung 5, and stomach 40. We use filiform needles and reducing method. Now let's go to illnesses of deficiency. This is where we do moxibustion. The most commonly selected acupoints, bladder 13, CV21, CV17, CV22, CV6, CV4, bladder 43, CV8, spleen 6, bladder 23, kidney 7, and GV4. Okay, let's discuss this case study. So we have a patient, 28-year-old female. She had recurrent wheezing attacks for over 3 years. Despite repeated treatment with anti-asthma drugs, antibiotics, and high-dose glucocorticoids, as well as Chinese medicines, and cutting of the REN17, the attacks became more frequent and more severe during the past year. She was transferred from another hospital. At time of admission, main symptoms were frog croak-like respiration with gurgling, may cough, shortness of breath, refusal to lie down kasi mas comfortable siya nakaupo. Her sputum was expectorated with difficulty and was white, sticky, and foamy, or sometimes yellow and viscid. Merong chest tightness and pain aggravated by cough. Throat was itchy, mouth is dry. The patient sat upright and refused to lie flat. Restless siya and agitated. She had cold aversion. Hands and feet were cold. Respiration was rapid and shallow, 64 breaths per minute. She was covered with sweat. Face was flushed, lips and nail beds were cyanotic. Tongue was red with pale yellow and greasy coating. Pulse was thread-like and slippery. Auscultation of the lung, meron pong wheezing throughout, and fine rels in the left lower lung. Diagnosis, wheezing illness. Therapeutic principle started with the accumulation of phlegm and heat in the lung and treated its loss of dispersion and descending function. So ibig sabihin, we need to improve the dispersing and descending function of the lung. Then we use the method of cooling the heat to unlock the lung and dissipate the phlegm. So I hope that helped. Any questions? That's very, very common po. No? So at least now, meron na po tayo idea on how to deal with it. Thank you very much. Okay, punta naman tayo ngayon sa Camarines Norte. Let's welcome Sir Alvin Palabay for signs and symptoms. Sir Alvin, can you hear us?
Yes, Doc. Hello, good evening, classmates.
Good. Okay, good afternoon pa. Okay.
Good afternoon pa ba? Sige, Doc. Sorry. So we are on our number 61, signs and symptoms. Ang topic natin is crack, corners of the mouth, and itching around the mouth. Okay. So sa crack corners of the mouth, kapag ang pattern is stomach heat, okay, ang signs and symptoms, mayroon siyang crack corners of the mouth, may thirst, may burning epigastric pain, sour regurgitation, nausea, excessive hunger, foul breath, a feeling of heat, may red tongue with a yellow coating, overflowing, and rapid ang pulse. Kasi nga, stomach heat siya sa crack corners of the mouth. So, stomach heat deficiency, nagkakaroon din ng crack ang corner ng mouth. So, dry mouth with a desire to sip water, ang mga symptoms. ng stomach-in deficiency pattern. No appetite or slight hunger but no desire to eat. May constipation, may dark stools, dull or slightly burning, epigastric pain, dry ang mouth and throat, especially in the afternoon. Slight feeling of fullness. All right. After eating, normal colored tongue without coating or without coating in the center. And ang pulse niya is floating to empty sa stomach-in deficiency. All right. So, stomach-in deficiency with empty heat, signs, empty symptoms, corners of the mouth, dry mouth and throat, especially in the afternoon, thirst with the desire to drink, small sips, bleeding gums, dull or burning epigastric pain, feeling of heat in the afternoon, dry stools, slight feeling of fullness after eating, night sweating, 5-pound heat, bleeding gums, red tongue or red corner, red center only, without coating in the center, floating empty and rapid ang pulse. All right, so let's proceed to another topic, itching around the mouth, stomach heat, yung ating pattern, may itching siya, intense itching around the mouth, especially at the corners and below the mouth, cold sores, foul red, burning epigastric pain, thirst or sour regurgitation, nausea, excessive hunger, a feeling of heat, red ang tongue with a yellow coating, overflowing, and rapid ang pulse pag stomach heat. Right? So next, liver blood deficiency with empty wind. So dito, slight itching around the mouth. Kasi nga, liver blood deficiency and empty heat, empty wind, dryness around the mouth, greenish color around the mouth, and trembling mouth, facial tick, slight flapping of eyelid, dark vision, floaters, unilateral numbness or tingling of the lip, pale empty tongue, choppy or fine, slightly wiry ang pulse. Right? So next, kapag ang diagnosis natin naman damp heat in stomach and spleen, of course, meron siyang itching around the mouth, wet rash around the mouth, cold sores, common to sticky taste, thirst with no desire to drink, a feeling of fullness, pain of the epigastrium and lower abdomen, poor ang appetite, a feeling of heaviness, may nausea, loose stools with offensive odor, a feeling of heat, dull and yellow ang complexion, sticky taste, red tongue with sticky yellow coating, and ang pulse slippery to rapid ang pulse. All right. So disharmony of penetrating and directing vessels. Meron din na nagkakaroon din ng itching around the mouth at period time or during the menopausal time, lower backache, dizziness, tinnitus, irregular periods. Other symptoms and signs depend on whether there is deficiency of kidney or kidney yang. Clinical note, the area around the mouth is controlled by the liver channel and the penetrating and directing vessels. So thank you so much for the opportunity. Any questions po?
Okay, thank you very much, Sir Alvin. Thank you for taking the time. Kala namin absent. Okay, maraming salamat po. See you tomorrow. Let's now proceed to the last but not the least topics. We are still nasa asthma pa po tayo. And let's listen again to Ma'am Mildred. Her topic is late onset non-allergic asthma. Good afternoon, Ma'am Mildred.
Good afternoon po ulit. So yung topic po natin pagpapatuloy ay ang asthma. Late onset non-allergic asthma. Tingnan po natin. Kidney deficiency and allergic asthma. The type of kidney deficiency involved in allergic asthma is deficiency of only one aspect of the kidney function. That is in connection with defensive Qi. It could be called deficiency of kidney's defensive Qi system, which is similar to lungs' defensive Qi system. Kidney deficiency involved only this aspect of its function, and therefore not many other symptoms and signs are present. For example, a child or teenager with allergic asthma would not have dizziness, deafness, tinnitus, backache, weakness, or night sweating. Yun. So, yung with allergic asthma na wala pong dizziness, deafness, tinnitus, backache. Yun po yung involve po doon na yung kidney. So, minsan po pag yung asthma talaga, pag tinitreat lang natin yung lungs, then hindi natin nakita yung mga connection niya sa ibang organ, hindi po siya gagaling. Kaya dapat nakikita natin ano yung pinanggagalingan. Nagkaroon po ako ng ganyang pasyente eh. Nung na-treat ko po yung kidney niya, napalakas ko yung kidney, nawala yung asthma. Pero kung lungs lang yung tututukan po natin nung pabalik-balik yun. Kaya nung nung pinattern weaving ko po, pinanggagaling na mahina yung kanyang kidney. Tinreat ko po munang lumakas ang kidney, nawala po yung asthma niya. So, yung clinical note po nito, the type of kidney deficiency involved in allergic asthma is a deficiency of only one aspect of kidney functions. That is in connection with defensive Qi. It could be called deficiency of kidneys defensive Qi system, which is similar to lung Qi defensive Qi system. So yun, magkapareho po halos yung function ng yung lungs kasi depends niya yung skin natin ano. So yung kidney, mayroon din po siyang defensive Qi system. Pag mahina po yun, natatalo. So pag may nalanghap tayo, hindi niya matulungan si lungs para i-defense. Halimbawa yun nga, yung nakaamoy ng ibang, yung mga pollen na nakalanghap. Pag malakas din yung kidney defensive Qi, tutulungan niya si lungs. So mawawala yung asthma. O, ganun po yung mga pagtutulungan ng organs. Yung traditional cures po of wheezing, yung xiao, and breathlessness, chuan, both contemplate a kidney deficiency as a factor in asthma, but only for its late stage in chronic cases. In allergic asthma, on the contrary, there is a deficiency of kidney defensive Qi system from the beginning. Sa mga bata po, yung mahabang wheezing at saka pag-ubo may induce a kidney deficiency, which is therefore the consequence of lung pathology. In atopic asthma, however, a kidney deficiency is the cause of condition and it's present from the onset of the disease. So it is also the cause of chronic wind to be lodged in the chest. So yung hindi naaalis yung wind na pumasok sa katawan, ngayon nasa chest. So interesting to note that atopic asthma often improves during pregnancy. So during pregnancy, allergic asthma improves if a third of women is aggravated in another third and is unaffected in the rest. I personally relate both an improvement and an aggravation of a symptom during pregnancy to a kidney deficiency. So yung mahalaga po kasi habang pinagbubuntis ang bata, 'di ba? Doon nakalagay yung gene essence na namamana ng bata pag lumabas. So kung mahina po yung kidney ng mother, pwede rin pong ma-transfer niya sa gene essence ng bata. So in the first instance, the kidney deficiency is actually improved by the pregnancy. And in the later instant, it is aggravated. So, pwede pong habang pinagbubuntis,
Nawala yung audio mo, Ma'am Mildred. The fact that the pregnancy improves or aggravates allergic asthma in 2/3 of women seems to show that a kidney deficiency is at the root of allergic asthma. So this will confirm the involvement of the kidneys in atopic asthma, as a kidney deficiency sometimes improves during pregnancy. Okay, there was a longitudinal cohort study of 1,861 children born to women who were recruited during pregnancy and followed up at 5 years of age in the USA, showed that low maternal intake of vitamin E during pregnancy is associated with an increased risk of developing allergic asthma. So this would confirm that the etiology of allergic asthma is an inborn deficiency of the kidneys. So andito na ulit si Ma'am Mildred. Are you okay now? So,
Doc, nawala yung laptop ko eh. Cellphone yung
ipakita lang, oo.
pen.
Yes.
Pakituloy mo muna, Doc. Ang late nung ano sa cellphone eh.
Let's now go to the kidneys and the immune system. So thus, the immune hyperreactivity that is the basis of allergic asthma, this is due to a deficiency of both lung and kidneys defensive Qi system. So they always go together. No? The kidneys influence the immune system not only through the connection between kidney yang and defensive Qi, but also because the kidney essence, through the governing, penetrating, and directing vessels, is partly responsible for protection from external pathogenic factors. So interestingly, Li Qichen says, when the qi of the channel overflows, it flows into the extraordinary vessels, where it is turned into irrigation, warming the organs internally and irrigating the space between skin and muscles externally. The fact that the qi of the channels overflowing into the extraordinary vessels goes to irrigate the space between skin and muscles confirms that the kidneys, through the extraordinary vessels, play a role in the protection from pathogenic factors and in the circulation of defensive qi in this space. Pero ngayon kasi masyado ng toxic mga kinakain ng tao and we're subjected to too much stress, humihina na po ang defensive qi, no, ng kidney. So Western physiology confirms this role of the kidneys in the immune defenses because all cells involved in the immune response are derived from a common stem cell in the marrow, which is a product of the kidney essence. So let's take a look at the figure 6-10. Okay. So we have sa marrow stem cell will arise the lymphoid progenitor cells and the myeloid progenitor cells. Okay, so ito ang mga myeloid progenitor cells na sa marrow, no? Macrophages, monocytes, eosinophils, neutrophils, and mast cells. Yung lymphoid progenitor cells, we have one arising from the which are now the B lymphocytes. Then meron tayong galing sa thymus, which are called the T lymphocytes. Low levels of cortisol that are secreted by the adrenal cortex will alter the immune function to allow an exaggerated allergic response. Okay. A Chinese study comparing the effect of Chao-Ching Long-Tang small green dragon decoction versus kidney tonics for atopic asthma showed that the kidney tonics had a better effect and that they reduced the levels of IgE. There are a few modern Chinese doctors who place the stress on tonifying the kidneys in asthma. For example, Dr. Zong Qi believes that in order to treat the inflammation process, the atopy and the bronchoconstriction, it is necessary talaga to nourish the kidney in. So Dr. Shen Si-Yin thinks that tonifying the kidneys is necessary not only from the perspective of Chinese medicine, but also from that of Western medicine. Sabi ni Dr. Shen, using herbs with a sweet and sour taste stabilizes the cell membranes. Therefore, meron siyang stabilizing effect on the mast cells in the bronchi. Dr. Shen also says that tonifying the kidneys, especially the kidney yang in asthma, regulates the immunity by regulating the T cells and reducing the levels of IgE. So, if you're not yet familiar with the immunology, the T cells, meron po tayong T helper cells, T suppressor, meron din tayong memory T cells, no? So, if you want your immune system to improve, you should have more of the T helper. Okay? Okay, so yun lang muna for now, para hindi tayo ma-overwhelm. Thank you very much for your attention. And